Okay, now the second component of our side posture adjustment is geared towards pretty much a pure sacroiliac joint mobilization. So here we're going to palpate the crest, go down, find the PSIS, the posterior superior iliac spine. That's going to be your contact. And remember that this joint is in an oblique plane like so. So you've really got to get down and under that PSIS. Go ahead and induce a little bit of rotation into your patient with your hands. And again, this one's going to be a thrust this way with a body drop, just like that. So again, the difference with the sacroiliac joint thrust is that you're going to hold the instrument against your leg here. I've got a nice fencer stance here. One leg is straight, the top knee is bent. I'm going to come down low as if I'm producing my plane in this plane, or producing my thrust in this plane. I'm going to get in there and make my thrust. Adding a little body drop. I think most chiropractors use some element of drop in their practice. The only one I use on a regular basis is my drop for the lumbar region, and I use that mostly for sacroiliac joint manipulation. And of course, everyone is familiar with that sound. If I was going to adjust Maria for posterior superior iliac spine that is posterior, in other words, my belief is that the ilium has actually rocked this way, come up like so. So the complaint is usually sacroiliac joint pain on one side or the other, and we're considering that the ilium has rocked in this direction, which makes the PSIS on that side more prominent. And of course, as the ilium rotates this way, it takes the leg with it. So the presentation will usually be a short leg on the side where you have the posterior inferior PSIS. And so probably the most effective and least expensive piece of equipment in anyone's clinic would be these little foam wedges. In this case, since I'm going to use my drop table here, I'm going to place the wedge just underneath the trochanter on this side, and then on the other side I'm going to place it underneath the top of the crest, because when I effect my thrust I'm going to add a little bit of rotation here, and I want this ilium to roll forward like so. So that adjustment looks something like this. And of course, when we're using our drop table, the whole purpose for the drop table is to minimize the amount of mass that you're applying to the patient, and we're using the element of speed that is generated by the force of gravity, and the amount of force that it takes to overcome the detent in your drop piece for your table is about the only mass that's really being applied. And then of course we're going to continue with that steady pressure through the adjustment, which is very, very crisp. So the Dynadjust lends itself beautifully for practicing drop moves, because you're using the element of speed that you can develop very, very quickly for almost any kind of drop table technique.